Welcome to today's episode of Hello Live, and we're here to talk about cannabis and chronic pain. And I'm joined with Chief Medical Officer Dr. Patricia Fry. Welcome.
Thank you, Pamela.
So can you tell the audience a little bit about yourself and how you ended up here talking about chronic pain and cannabis?
Well, I started in cannabis medicine several years ago as Hello MD's first physician.
Whoop, whoop.
Yeah.
Loved it. You took a chance.
I took a chance, and I've been practicing cannabis medicine ever since. I have seen thousands of patients with chronic pain, as well as other disorders and other conditions, and I have found cannabis to be a really remarkable plant and helpful for many patients.
And if I remember correctly, you were a little bit on the fence about cannabis when you first started working with us. And tell us what that journey was like of going from being kind of, I don't know so much about cannabis, to now where you are today as a leading expert in the nation.
Well, when I started with Hello MD, I knew nothing about cannabis. And I actually learned so much from the patients that I talked to. And in between patients, I was reading everything I could find. And it's kind of funny that a lot of doctors say, well, there's not enough research on cannabis. And there's not. There are still a lot of things we don't know. But the National Institute of Health has a library online that has over 40,000 journal articles on cannabis and the endocannabinoid system, and so I have learned a lot over the years. I have studied at the University of Vermont and am certified in cannabis science and medicine, and it was all because of my job at Hello MD.
Oh, you stole my heart. So if you're interested in reading more about cannabis research, you can keep yourself busy with those 40,000 research articles. And why don't we dive straight into asking some questions about chronic pain, because it's so common,
It is.
as you know. And it, like as you said, there are a lot of other disorders that may come with chronic pain. So the question is this: chronic pain is a symptom of a myriad of conditions. Can you talk about some common conditions that are associated with chronic pain?
Certainly. We certainly see degenerative issues like osteoarthritis in patients as they age, in degenerative disc disease that causes low back pain and sciatica. We have chronic pain that's related to daily headaches, to cluster headaches. We have neuropathic pain that's often caused by diabetes or chemotherapy. So those are, I would say, are the big issues. We also see pain associated with autoimmune illnesses like rheumatoid arthritis, psoriatic arthritis, lupus. We have pain that's associated with neurodegenerative illnesses like multiple sclerosis and Parkinson's. So
That's a whole lot of pain.
It's a lot of pain, but I would say the most of the pain we see is from degenerative issues or from pain associated with things like diabetes.
Okay, and chronic pain is technically any pain that lasts for more than 3 months, is that correct? 90 days?
Yes, some people define chronic pain as pain that's longer than 3 months, some say 6 months. In my mind, any pain that outlasts a reasonable amount of time for that tissue to heal, whatever the issue was that caused the pain in the first place, then it goes into chronicity. And that type of pain is maladaptive because it's not helping anything. When you first have an injury, or you first have an issue,
Like breaking a leg,
or even something pressing on something that's not supposed to be, that's signaling the brain that something's wrong and we need to do something about it. It's like hey, pay attention over here, we have a problem. Once the brain knows about the problem and we can set things into motion to start with healing and give it time to heal, if that pain continues, it's what we call maladaptive, and it's a problem and it needs to be taken care of.
And if it starts with mal, you got to get it out.
That's right.
All right. So I'm going to give you a did you know fact. Are you ready for it?
I'm ready.
Okay. The most common type of chronic pain is low back pain, then headaches and migraines, then neck pain, then fascial pain. Is that like when we talk about fascial pain, is that sort of like TMJ or jaw pain?
That's more like fibromyalgia and myofascial pain syndromes, where we have this saran wrap around all of our muscles and organs, and it's called the fascia. And when that's inflamed, it can cause pain. So oftentimes patients with fascial pain will have what they call trigger points, and this is very common in a condition like fibromyalgia.
So a reminder for everyone out there in our audience, if you have a question about chronic pain and cannabis, please use the chat and ask your question, and one of our knowledgeable HelloMD doctors will answer your question. Dr. Fry, can you use cannabis instead of opioids for pain management? What are your thoughts on this?
Oh, absolutely. Cannabis is so much safer than using opioids. When patients use opioids for more than a week or so, the body will develop a physical dependence. And after a while, the body will need more and more of that opioid to get the same pain relieving effect. And if you get into doses that are too high, because we have opioid receptors in the area of the brain that control respirations, we can get into problems with breathing if we take too much. And that's how opioid overdose deaths occur.
And also people might be drinking alcohol, they might be combining with other medications. It just seems like it gets into a very tangled web very quickly.
It does. And the more that those other substances are combined, the more likely that overdose is going to occur. And it's particularly problematic with mixing opioids and benzodiazepines.
Which is like a Xanax or something like that. A Valium, would Valium be a
Yes.
Okay.
So with cannabis works at pain in different levels, different layers. Cannabis is an anti-inflammatory, so it takes care of the inflammation. If there's nerve irritation and what we call neuropathic pain, cannabis is effective in treating that. If there's muscle spasm, the cannabis will relax the muscles and reduce that pain. If there's anxiety and depression associated with chronic pain, and there commonly is, and those emotions actually can signal the release of pro-inflammatory mediators or compounds in the body that cause pain, cannabis can help that as well. So by using cannabis, I can treat a patient who's been on an opioid, a benzodiazepine for their anxiety, a muscle relaxant for their muscle spasm, and reduce that opioid dose at least by 50% in just a few weeks.
That's amazing. And at HelloMD, we did a study with UC Berkeley a couple of years ago where cannabis was actually introduced into chronic pain opioid medical regimes, and people found that they were able to drastically reduce their opioid use, if not eliminate it.
Absolutely. I believe it was over 90% were able to reduce their opioid dose, and it almost that many actually got better relief. And the reason that cannabis is so helpful is because when you take opioids for a long time, it causes a condition that we call opioid-induced hyperalgesia. So the opioids actually make the patient more sensitive to pain. So when we start with cannabis, they're almost immediately able to reduce their dose. That eliminates the opioid-induced hyperalgesia. The person becomes a little bit more sensitive to the opioid, so they're able to get the same, if not better, pain relief than they had when they were just taking the opioid. And then we just gradually wean them off. And in addition to that, because if you have a physical dependence to an opioid, patients are concerned that they may experience some of those symptoms of withdrawal, and cannabis helps that too. So patients are feeling better, doing better, and on less medication.
Well, and unfortunately, over 65,000 people a year are dying from opioids in this country. So even if you're just tapering back the opioids, that's still enough to keep more people alive per year.
Yes, just by lowering the dose increases the safety profile of that opioid.
Well, I wish that more doctors were aware of the efficacy of cannabis and how to actually advise people on how to introduce cannabis into a pain regime, because we are in the midst of a real crisis right now. So that's great information. So I'm going to give you a did you know fact. Are you ready?
I'm ready.
Okay. This is staggering. In 2016, healthcare providers across the U.S. wrote more than 214 million prescriptions for opioid pain medication, a rate of 66.5 prescriptions per 100 people. Why is this still happening?
There's still a lot of pressure from the pharmaceutical industry and from patients who are in states that don't have medical cannabis who still need pain relief, and they are encouraged to still write those prescriptions. I would have to say, though, that in the states that have passed medical cannabis, the opioid overdose rate has decreased by 25%.
And it's also, which is, I think, correlates to this, is the amount of prescriptions written have gone down significantly as well. So that is a really positive trend that we want to see continue.
Exactly.
How would you advise someone who wants to consume cannabis as a way to wean themselves off of opioids?
Well, first I advise the patient to talk to their doctor, to talk to their healthcare provider, and let them know that that's what they want to do. There's some opioids that need to be reduced very slowly, and the doctor should be able to guide the patient on how rapidly they can reduce that dose. And then there's some of their medications that may be long-acting, may not be amenable to cutting the dose, to cutting the tablet, or so the patient needs to ask their doctor to rewrite their prescription in a way that they can lower the dose with the whole tablet. And it's not that difficult. We can start cannabis right away, and I have patients, if they have a short-acting opioid, I just say get a pill cutter, cut that in half, and try half a dose when your next dose is due. And then they can wait an hour and see how they feel. And if they feel they need that other half, they can take it. More times than not, though, they don't need it because we've adjusted the cannabis dose to take care of the pain.
That's great, but just a question for you in reaction to your answer. Most doctors aren't aware of how to consume cannabis and introduce that into an opioid regime. So how do you advise patients when the doctor wants to reduce the opioids, but they can't necessarily help them with what cannabis to take, how much, so on and so forth?
The patients can go to their Medical Cannabis Commission or programs websites. Oftentimes they will list the doctors who are in their area who do have some knowledge in cannabis medicine that can help them with their dosing with the cannabis. They can go.
They can also come to HelloMD and schedule an appointment to talk to you or one of our other doctors.
Oh, they certainly can.
But that may not be available to everyone. So either going in person to find a cannabis clinician or coming to a place like HelloMD, that's always advisable.
Yes.
Just a reminder to everyone, if you have a question about chronic pain and cannabis, please feel free to put your question into the chat, and one of our knowledgeable HelloMD doctors will answer your question. All right, so next question. Actually, we're going to move into a did you know fact, which I'm sure you probably already know.
I might.
You might. Hopefully, you might learn something out there. Did you know that only 23% of patients actually find opioids effective? Is that true?
You only have to have 30% be effective for a pharmaceutical to be declared FDA approved. So that does not surprise me.
Wow.
Not only that, did you know?
I probably didn't. Go on.
That there are no studies to support the use of opioids for longer than a couple of weeks.
I did know that.
Okay.
The opioids were developed to treat acute pain,
Yes.
which is typically acute pain will last from anywhere from 3 to 5 days. Isn't that correct? And so they were developed to treat that, and then it started to become a marketing campaign to treat chronic pain.
Yes.
But what's the fallout from that?
We have way too many opioids out there and too many people taking too much of them. Prescription opioid medication is the leading gateway drug to heroin abuse.
I did know that, and unfortunately now that's also introducing problems with fentanyl, is it
Yes,
not?
fentanyl, yes.
Yeah.
Yes, a very potent medication that was only used in the operating room for years and years. And now it's in the communities and people are dying from it.
Here's a very common question that we've been getting online. I'm taking pain meds after my knee surgery and I'm out of it and groggy when I do. If I add